Hi, welcome to the BioBalance Healthcast. This is Dr. Kathy Maupin, and we're continuing our discussion about BioBalance Skin, one of the parts of BioBalance Health where we rejuvenate skin.
Right, and I'm Brett Newcomb, and we have our guest with us again today, Abby Calabio. And Abby is a nurse practitioner and a medical esthetician. And in our previous episode, we talked about what those terms mean and how Abby does her work, but we'll get her to remind you of that in case you missed the other episode. Tell me what a nurse practitioner is as opposed to a nurse, and tell me in a sentence or two what a medical esthetician does.
I'm a nurse practitioner, so what that means is that I have advanced training. Usually nurses, it's a 4-year degree, but I actually have gone on to get my master's degree as well.
So, but not everybody that has a master's in nursing
No.
is a nurse practitioner. It's actually a licensed credential that allows you to do certain things that nurses are not allowed to do.
Exactly, and one of them is to really, I can actually prescribe medication. So when you come to see me, you know, if we're talking about certain services and you're needing, let's say, Retin-A or something like that, I can prescribe that to you as well.
Mm-hmm.
Okay, so there's a class of drugs that you're authorized to prescribe.
Yes.
And then as a medical esthetician, what is that?
What it means is that I actually I've specialized in medical aesthetics. So I am able to do non-invasive cosmetic procedures like Botox and fillers. At the same time, I'm also capable of doing laser treatments.
So what comes to mind, and I know I'm abysmally ignorant in this field, so I'll rely on you to help me. All through childhood, I had a friend in school that had a massive port wine stain, a purple coloration on the face. Could you help somebody with that? Because that poor girl suffered so much abuse as a child because she had this discoloration.
Oh, definitely. I mean, we have, at BioBalance, we have, the latest state-of-the-art lasers available to our clients that can treat issues like, discolorations of the face, as well as any issues with, photo aging, sun damage, or even just improving their overall, skin tone, texture, skin rejuvenation.
So you say the latest equipment. That suggests that you don't buy secondhand used stuff?
No, we don't have refurbished equipment. We have what's brand new, what's out there, what's in right now.
You have the best equipment, the newest equipment. You also have and you are one of only 3 in the St. Louis metropolitan area that do what you do, that have the
correct.
Credentials that you have to do what you do.
I'm really just one of 3 nurse practitioners that specialize in medical aesthetics in St. Louis. Yeah.
Okay. And so in our last episode, we talked about the different skin treatments that you do for rejuvenation of skin, and you talked mainly about the injectables, the Botox, the Juvederm, the Red S. And there was a whole other category of treatments that you specialize in. And that has to do with an IPL, what is that?
Correct. What the IPL is, it stands for, it can stand for intense pulse light or intermittent pulse light. What's great is we have a laser that's called the Alma laser. And the Alma, what's nice about it is it's multifunctional. So it provides...
I always wanted a multifunctional laser.
It provides IPL treatments. At the same time, it also does pixel for laser resurfacing, and also has a modality for laser hair removal.
Okay, so
Break
so
that down.
I bought this machine because it was like Barbie with all of the accessories. I mean, you have one laser and you can switch out what you need right then. So if a patient's getting her IPL and she goes, "Oh, you know what? IPL takes out the brown spots, helps make the texture better, makes her skin tighter." And then she says, "I need these wrinkles gone, and I just really need to have more collagen. I want to be even tighter than that, so we can do the pixel, which is a fractional laser. It goes down. Pixel means tiny little dots, and so it uses tiny little dots to go very deep into the collagen and stimulate it, as well as makes the texture of the skin better and tighter."
So what does that result in when you stimulate collagen?
That makes your skin smoother
and tighter.
It gets rid of wrinkles. You can use it on wrinkles. You can use it on stretch marks.
So the laser doesn't burn the surface of the skin. It penetrates into the substrata.
Yeah,
Right.
what it does is it creates these like micro channels deep in the tissue, and when it does that, it kind of fills with collagen, and from there, it
The
really
body naturally fills it with collagen, so that
and
stimulates
then
it.
it stimulates the growth.
Okay.
I usually like to tell patients it's like aerating your lawn.
Okay.
You're like putting those multiple channels,
But without big pits.
yeah, without big pits. But it's kind of like that same concept. It's like you're putting these channels, in the soil, and then it absorbs nutrients and stimulates the roots
Right.
and the grass. Same,
Yeah.
really the same concept. What
Gardening
happens with the skin.
for your face.
Exactly.
is our
That's
next
what it
episode.
is.
So when you talk about skin issues, I mean, the thing that I hear a lot of people my age talk about, because I'm marginally elderly, is the risk of skin cancer.
Definitely.
So you can identify precancerous discolorations in the skin, and you can treat them with the laser that you have, so they don't ever become cancerous.
Especially with that IPL laser, it's a light-based laser, and so what it does, it targets that damage that's deep within the skin and brings it to the surface.
So
it
that
heals
It
suggests
heals it. So after a few days, those brown spots start peeling and sloughing off, and that's the precancerous cells that we're getting rid of.
is that a one treatment thing, or do sometimes they're deep enough or dark enough? Does it matter if they're dark as opposed to light?
With one treatment, you are going to see a nice result, but really it's a series of treatments to really get rid of all those brown spots,
Okay.
and to really just even out your complexion.
Is that just on your face?
No, you can actually use it for your face, your neck, your chest, and also hands are a great treatment to do.
Like what they used to call liver spots?
Yes, and it treats those as well.
Because I
Those
can
are
remember
very
my
important.
stepmother.
Because that really
putting
shows aging in women.
Real light-skinned redhead, and she had what she called liver spots, and she put this massive amount of cold cream on them every day, and it never really helped.
Yeah.
No,
But that
it
was
doesn't.
50 years ago, so.
But I started getting IPLs long before I had my own machine, and I was 40, and the very first one I had, I looked like I had a terrible disease because I'd done tons of sun damage. I mean, iodine and baby oil was what we did back in the 70s. So I had damaged my skin a lot and never used sunscreen before I had the IPL.
Sure.
But when it came to the surface, it was big, black, horrible spots. So for about 3 or 4 days on the first treatment, I really didn't plan to go out. After that, every treatment was a lot less dark. I usually just could cover it with makeup, and that's what we see with our patients, is that as you go through a series to begin with, usually you do face and hands and possibly chest, and then after that, once a year, I go back for an IPL. And I get all the other, it's kind of like maintenance. I get whatever damage I created through the summer. When it hits the fall and I don't have a tan
I was
anymore.
going to ask you about that, because you
then-
don't do it with a tan.
Right, and IPL is the only thing really that we can't do with the tan, maybe hair removal as well.
So what if you're dark-skinned? I mean, not tanned, but just naturally pigmented, darker.
So for someone with darker skin like myself, I'm really not a candidate for the treatment because it's attracted to the melanin, that pigment. So let's say if I had done the treatment, I would be really blotchy. It could even burn me too. So it's really not
I'm
ideal.
as dark as you are, and I do it. I just think you have to.
I
We
mean,
just do the spots that need to be done. You don't have to do
overall,
your
You don't do a
overall
Michael
face.
Jackson treatment.
no,
But
no.
actually, our Alma laser will allow us
Okay.
to do that on our especially with hair removal. If the hair is darker than the skin, we can do that, and we have one head that's like for our skin tones, and that laser can do darker people.
When you do hair removal, I mean, what kind of, I know bikini line kind of issues, but there are other issues.
You don't want to talk about that too?
Sure. No, what people come in and they say, oh, hair removal problems, and that's the only thing that comes to my mind. What else do people have issues with?
You mean where their hair, where they
Yeah,
have hair?
I mean, like, my hair's all fallen off the top of my head and gone down on my back.
You could do your underarms, your full. You could
Seriously.
do full leg treatments. You know, for men, we do a lot of backs and even just chest. I mean, we're not trying to get rid of all the hair,
Right.
but really to reduce it. You know, so you're not like a caveman.
Like a woolly bear. Yeah, exactly. Yeah. And
so-
people get their
some women-
underarms done?
Yeah.
And it doesn't hurt? Mine are really
no.
sensitive.
No, we have this is the benefit of having the newest machine.
It's very gentle.
It doesn't hurt. In fact, I treated a gentleman
That makes
who-
me hurt just thinking about it.
I treated a gentleman who wanted his chest hair either removed totally or decreased at least. and we did a series of treatments, and he said he had tried it before, probably 5 years before, and it had hurt so badly he never went back. Well, I did this treatment on him, and he said, it doesn't hurt, is it really working? And I said, yeah, and in about 5 days it's going to all fall out, and it did.
Okay, so it doesn't like burn it off today, like if you
No.
were camping and you put your hand over the flames.
You
And
shouldn't have any kind of like
No.
sunburn or burning reaction with the laser hair removal.
Okay.
But we do women's arms. You know, they don't want to have hair on their arms. Some women actually have hair down the middle of their abdomens, and you can take that off. I mean, they don't want to have that.
So pretty much all hair is fair
anywhere.
How
Now,
did-
if it's white hair, I mean, we couldn't do your beard because your hair's white. It has to have a
It
color.
has to have a color,
has
some
pigment.
pigmentation.
Has pigment.
Because that's what the laser finds and burns.
That's attracted to that melanin, that pigment that's in that hair follicle.
Okay.
And my advice to people we're all getting older, who have dark hair that they want to have removed someday, is do it now before it turns gray. Because then we can't do much with it. And I'm not sure that there's a laser out there that can do that.
Yeah, there's not. There's no lasers that can treat really blonde or
And you
gray
can't
hair.
dye it or color it
No.
and then have it burn that color. It has to be
It's the root.
Yeah, it's the root.
It's below the skin.
Right.
Okay.
And we're killing the root of the hair follicle.
And then it never comes back.
Not that hair. You can get hair in other places because hair has an 45-day cycle, and so you're going to have to.
So you might have to have two at least.
There's, like there's
treatments.
different cycles of hair growth. In certain cycles, there's more pigment in that hair follicle. So at that time, it's more susceptible to that laser. So that's why it's a series of treatments. You want to get it at that active growth phase of that hair follicle when it has the most, color in it.
So do you do aesthetic designs in hair?
No.
No,
Just thought
we
I'd ask.
don't do requests.
Yeah, we don't.
No, we do what area you want to have done, and we listen, but we don't do artistic.
There's no
drawings.
designs with hair reduction.
Yeah.
But that's the hair removal is kind of one of the things that lots of people do when they're younger, and so that's a good treatment for younger people. If you're thinking about getting a gift certificate or something for your teenager, they love that.
Well, talking about younger people, one of the cultural changes that I'm concerned about is the proliferation of tattoos. And I remember years ago, Lee Trevino, a golfer, had somebody's name tattooed on his arm, and then they were no longer together, so he always wore a Band-Aid to cover that up. Can you do tattoos? I mean,
We don't have a head for tattoos.
We don't have a head for that, but there is lasers out there that are effective for the tattoos. Keep in mind, though, when you have that tattoo, the easiest color to remove is black because it's the darkest.
so if you get all the exotic colors, you're in trouble.
Yeah, so if you've got the pastels, like yellows, orange, it's very difficult.
And it leaves you without melanin in that area.
So you're susceptible to other burning issues.
Well, or you have a white area where you had a black area.
Almost like a skin graft kind of look.
Right.
Okay.
So it's not going to be your normal melanin coming in.
So this is really fascinating stuff, and it's not cutting edge because it's a laser.
Yeah.
But it's the
a
leading
non-cutting edge.
The non-cutting edge of medical involvement. If you are interested in knowing more about these procedures or the injectable procedures that we talked about in the last episode, you can contact Abby at BioBalance Health, and you can contact BioBalance Health by
Calling 314-993-0963, or you can get on our website, biobalancehealth.com.
or you can reach me at brettnewcomb.com.